Hey, you guys, welcome back. Today I will be talking about the coronavirus and being pregnant and breastfeeding during these crazy times. I am pregnant myself. I am 19 weeks. I am also a doula, so I am surrounded by other pregnant women. And I have had clients tell me, like, hey, I'm kind of nervous. Some are nervous and some are not. Some have questions because they they're kind of concerned about how the hospital policy or procedures um, will change because of the coronavirus, and it has already been changing. Some hospitals are saying only one support person with the mother during labor and delivery. And I had one client that was just like, hey, I wasn't even able to go in during the time because they perceived her as high risk, um, the support person as high risk, um, because she seemed, you know, maybe sick, but it wasn't the coronavirus. The other thing is, I have had clients switch from having plans to, give birth at the hospital to actually doing a home birth now. So it's just a lot of things going on. So what I wanted to do, let me pick up my paper, is talk about it. I actually printed out the the little article, pregnancy and breastfeeding, off of the CDC website. So since I'm not an expert, I am going to CDC and printing out what they have. Okay, and so I'm just going to skim through it and give you guys answers, um, answers to the questions they have posted on the page. So the first question is for pregnant women. It's asking, what is the risk to pregnant women of getting coronavirus? Is it easier for pregnant women to become ill with the disease? If they become infected, will they be more sick than other people? The answer is they currently do not know. They're still learning about the coronavirus. In general, what they're saying is pregnant women, they do experience changes to their bodies, um, and those changes may increase their risk of some infections. Um, so what they are saying is respiratory infections and flu are in the same family as the coronavirus, and women have had a higher risk of developing severe illness. So, with all that said, they're saying it is always important for pregnant women to protect themselves from illnesses. So, pregnant women, protect yourselves. The next question follows, how can pregnant women protect themselves from the coronavirus? And over here, they listed only like three things. And if you want more, you can dig deeper. Um, Go back to their, like, there's an actual link on how to protect yourself. But I guess the three common ones, or the three most important ones, are staying away from sick people. If you're going to cough, please cover your mouth, not with your hands, elbow. It even says on the paper that your elbow is a good technique. The third one, which is the most important one, it states to clean your hands with soap and water, H2O, and to have water or alcohol based sanitizers like as a backup. But if you have soap and water, please use it. And if you have more questions about how to protect yourself, go onto the website itself and look it up. But the other things I have read is do not touch your face. Like if you're out and about and you touch a doorknob, don't touch the doorknob and then go, don't do that. Doorknob, hand sanitizer, or go to the sink, you know. So that's one thing. If you're going to have a mask, still use the same protective measures of washing your hands before you touch your face. Now, I'm going to scratch my face. I'm at home. My hands are clean. Everybody is good here. It's 6 deep, so we're not trying to get sick. So the next question is, can the coronavirus cause problems for pregnancy? They do not know. They do not know if it can cause problems during pregnancy or affect the health of the baby after birth. Can the coronavirus be passed from a pregnant woman to the fetus or newborn baby? They still do not know, but what they do know is that women that have tested positive for the coronavirus, their babies have not tested positive. So I can have coronavirus. I birthed my baby, but my baby is fine. Um, they're saying that the virus was not found in samples of amniotic fluid or in the breast milk. Now, with that said, I have seen an article about a newborn baby somewhere in Europe that tested positive for the coronavirus. But then again, that was on social media. So I don't know how true that is, but I am just going to let you guys know what the CDC is saying right now. Right now, they're saying babies have not been tested positive yet, right? That have been born from a mother that has been tested positive. Okay. Um, Infants. Now, it's kind of repeating itself, but I'm still going to follow it. If a pregnant woman has coronavirus during pregnancy, will it hurt the baby? They do not know what the risks are. Um, any risk is posed to infants of pregnant women who has coronavirus. They do not know. But what they have noticed is that women that have tested for the coronavirus during their pregnancy, they have had preterm labors, but they don't know like if there's a true correlation between the coronavirus pregnancy and preterm labor. They don't know. It could be other factors involved that cause the mother to have preterm birth. Okay. So this page is all about breastfeeding. It's the second page. You could print it yourself off of CDC website. The second page is all about breastfeeding. The the transmission of coronavirus through breast milk. So they're saying that the virus has not been detected in breast milk. However, they do not know if a mother that's been tested with the coronavirus can transmit the virus via breast milk. So they haven't found it yet. They have tested mothers who have tested positive with the coronavirus. They have tested their amniotic fluid and the breast milk, and they have not found the coronavirus in the breast milk, but they still don't know, right? Because anything is possible. What they are saying is if you are breastfeeding, continue to breastfeed. They said that breast milk provides protection against many illnesses, right? So if I have the coronavirus and I'm breastfeeding my baby, I am passing antibodies to my baby, and my baby is receiving the antibodies against the coronavirus. So that's a plus sign. They're also saying breast milk is the best source of nutrition for most infants. And there are rare exceptions when breast milk or feeding a baby with express breast milk is not recommended, only rare cases. But for right now, they're saying if you are breastfeeding, that's what you're doing, that's what you want to do, and you're sick, please continue to breastfeed your baby. The other thing is, if you are sick and you want to breastfeed, they're saying wash your hands before you touch your baby. You want to lower the risk of transmitting the coronavirus to your baby. So wash your hands. When you're breastfeeding, they also recommend it in the article to put on a mask because your baby's like right there. And if you are going to pump, to avoid holding your baby while breastfeeding and stuff like that to lower, I mean, how can you do that? Not have contact with your baby, but you're just trying to, do all that you can. I get it. So if you are pumping, to please wash your hands before you touch the pump. Wash, make sure your hands are clean before you pump, and then make sure everything is clean afterwards. So after you're done pumping, wash the pump, wash the bottle. Make sure your hands are clean when you're putting the milk into the bottle and you give to the baby. And they're still recommending to hold, not to hold, to wear a mask while feeding your baby with a bottle. Or they even said, better yet, if you can, give the bottle to someone else and they feed the baby, and make sure your hands are constantly clean. So I hope this helps somebody. If I confused you, and you're like, what is she talking about? Go to the CDC website so you can find out more information about it if you're pregnant or if you're breastfeeding. So good luck to everybody, and stop taking all the freaking toilet paper. All right, bye.